It's Patrick Hutzel from intensivecarehotline.com with another quick tip for families in intensive care. So I've just come off a call with a client who has their mother in intensive care on a ventilator with a tracheostomy. She had a stroke about 4 or 5 months ago. She had a tracheostomy, had a PEG tube, was sent to LTAC after about a month in ICU, bounced back from LTAC to ICU within a few days, just as we have witnessed probably hundreds of times now over many years, especially for our US clients. And because LTACs are very unique to the United States, they don't exist in other countries. So, and just like we've warned before, never ever let your loved one to go into LTAC. This is another sign here, where again, client leaves ICU, goes to LTAC and bounces back within less than a week with many, many complications. Because, when a ventilated patient goes out of ICU and goes into LTAC, where there's non-critical care trained nurses looking after ventilated and trach patients, the disasters are waiting to happen. When someone is ventilated and having a trach, they need critical care nurses 24 hours a day, not staff in LTAC that, where there's RNs that are not intensive care trained, they have no ventilator or tracheostomy experience, or even worse, there's LNPs employed. There's no or very few doctors on site. It's a disaster waiting to happen. And now this time round, the hospital wants to send our client's mother get back to LTAC, and the very same LTAC, as a matter of fact, and the family is obviously opposed to that because they've seen last time what happened. And thankfully they have learned from their previous experience, because they had no idea not to give consent to a PEG tube. They just followed blindly, and they were running towards the fire, only realizing that when their mother was at LTAC, how bad it is. And then she bounced back into ICU within no time. I have made countless videos about this, that patients who go to LTAC bounce back into ICU in no time. And this is exactly what's happened here. So now the ICU is pushy again, wants to do the same thing again. I mean, you know that the definition of insanity is doing the same thing over and over again, expecting a different result. And this is where this family is really at crossroads again. Why would they let their loved one go back to LTAC where it ended up in a disaster last time? So what to do? Well, what to do in the first place is, if you have a loved one in a similar situation, never ever give consent to a PEG tube, because the PEG tube opens the doors for LTAC to take those patients. Usually LTACs cannot take patients with a nasogastric tube instead of a PEG tube. There are exceptions to the rules, and some LTACs will take patients with a nasogastric tube, but most don't. That should also tell you everything you need to know about their skill level. The skill level is really poor, right? If they can't look after a nasogastric tube. That also means they're not skilled in looking after a ventilator and a trach if they can't look after a nasogastric tube. Again, there are exceptions, but there are far and few in between. So what to do in a situation like that? Well, first off, you need to check if your loved one has potentially run out of insurance entitlements. Most patients are not, because if there's a clinical reason for them to stay in ICU, the insurance often pays, right? That's number one. Number two, you need to get a second opinion. You need to have someone like us here at intensivecarehotline.com to look at medical records and find the reasons why, your loved one can't go to LTAC, because they're simply not ready and the disaster is waiting to happen. So we can help you with that. Number three, ask for the hospital discharge policy. The hospital discharge policy most likely will say that a patient cannot be transferred to another facility without patient or power of attorney consent. If they don't show you the hospital policy, you know what's in there anyway, right? Because that's what the policy will say. And lastly, you can and possibly need to make a complaint to hospital executive and put a stop to it. And you will find that if you make a complaint to hospital executive, you will actually find that things will change for you, because hospital executives cannot deny or ignore the complaint of a patient or a family. So that is my quick tip for today. If you implement those strategies, you will see that results will follow. And that's how we've helped families in similar situations for over a decade now. getting tangible results. And out of that, we build a membership for families of critically ill patients in intensive care, where we answer your questions. Our membership you get access to at intensivecarehotline.com if you click on the membership link, or if you go to intensivecaresupport.org directly. In the membership, you have access to me and my team 24 hours a day in the membership area and via email, and we answer all questions intensive care related. Now, I also offer one-on-one consulting and advocacy over the phone, Skype, Zoom, WhatsApp, Skype, whichever medium works best for you. And I talk to doctors and nurses directly. I talk to you directly. I ask all the questions that you haven't even considered asking, but must be asked when you have a loved one in intensive care, so that you make informed decisions, have peace of mind, control, power, and influence. Now, I have worked in intensive care and critical care for over 20 years in 3 different countries, where I also worked as a nurse manager for over 5 years. And I have been consulting and advocating for families in intensive care since 2013 as part of my intensivecarehotline.com consulting and advocacy service. Have a look at our testimonial section and see what our clients say. Have a look at our podcast section with some client interviews. We can confidently say here we have saved lives with our consulting and advocacy, and we can do the same for you. We also offer medical record reviews in real time, so that you can get a second opinion in real time, once again, so that you can make informed decisions, have peace of mind, control, power, and influence. I also offer a representation in family meetings with intensive care teams, so that you don't get walked all over, and that you have a strategy when going there, and I assess with you whether you should even go into a family meeting in the first place. Also, we offer medical record reviews after intensive care if you have unanswered questions, if you need closure, or if you are simply suspecting medical negligence. Now, we also offer medical record reviews after intensive care if you have unanswered questions, if you need closure, or if you are simply suspecting medical negligence. All of that you get at intensivecarehotline.com. Call us on one of the numbers on the top of our website, or simply send us an email to support@intensivecarehotline.com with your questions. Thank you so much for watching. If you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, comment below what you want to see next, what questions and insights you have. Thank you so much for watching. This is Patrick Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.